Hi, I'm Dr. Cassie Calabrese from the Cleveland Clinic, and I'm here at ACR 2016 in Washington, D.C. I just left the Year in Review, which is an excellent summary of highlighted published work from the year. I will focus on the clinical presentations, which were presented by Ingrid Lundberg from Stockholm, and she did an excellent job summarizing the highlights of the year. She broke down her presentation into 4 categories, starting with preclinical disease states, and then predictors of progression, classification, and treatment. I thought this was a very nice way to break it down, and starting with preclinical disease states, which preclinical RA specifically, which was a hot topic at EULAR this summer. She summarized 2 papers that comment on how we can predict preclinical disease, one about ultrasound imaging findings and another with MRI, showing ultrasound findings can predict disease progression in patients that are Akba positive without clinical synovitis, and another showing MRI findings can predict disease progression in patients that have arthralgias without specifically clinical disease. Another good paper, which was a little different, that she highlighted, showed a role of Akba in pain in rheumatoid arthritis, specifically that Akba binds osteoclasts and stimulating production of IL-8, which binds nociceptors and actually causes pain. And this paper showed mice, Akba-positive mice injected with IL-8 blockers helped to prevent pain on this rheumatoid arthritis model. Another important paper from the year by Kinslow et al. In Arthritis and Rheumatology showing increased IgA plasmablasts in patients at risk for RA, not with preclinical RA. And we actually covered this in Rheumnow a couple weeks ago. And this is very important and suggests some mucosal inflammation as part of the pathophysiology of preclinical RA. Another kind of different paper that she presented by Kim et al. That was presented in the Journal of OB-GYN this year showed that they identified angiocentric factors that increased risk for poor outcomes in pregnant women with lupus and or antiphospholipid antibodies. And this was important and helps us remember we need to have a timely risk stratification of our pregnant lupus and antiphospholipid positive patients. Of course, they couldn't forget to touch on the new classification criteria for Sjogren's syndrome, which are now endorsed by EULAR and ACR and focus on more objective measures for diagnosing or classifying Sjogren's syndrome. And finally, hot topics of the year are tocilizumab for treatment of PMR and GCA. She touched on a couple papers talking about that, starting with a phase 2 double-blind placebo-controlled trial of tocilizumab in GCA, specifically in induction and maintenance of remission, looking at tocilizumab given every 4 weeks for 52 weeks with glucocorticoids compared to placebo with glucocorticoids, showing significantly higher rates of clinical remission in the study group, significantly higher rates of time to taper off steroids, and lower cumulative dose of steroids in the study group. And there were 2 open studies also on tocilizumab and PMR, one from France and one in the United States, that both showed positive results. So it seems that IL-6 inhibition may be a safe and effective option for treating GCA and PMR. Of course, we need phase 3 studies, and I look forward to seeing the other abstracts presented at this conference on this topic. And stay tuned for more info from Rheumnow at ACR 2016.